Hello and welcome to this presentation on neurological and neuromuscular pharmacologic agents by Nicole Treb, Leah Zwilling, Sarah Tasto, and Sherry Steffes. In this presentation, we will discuss the classification summaries for both categories, 3 types of drugs per category, typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. First, we will take a look at neurological agents. Neurological agents can be classified as anticholinergics, dopaminergic, dopamine agonists, acetylcholinesterase inhibitors, MAOB inhibitors, and COMT inhibitors. Neurological agents can be used for Parkinsonism and Alzheimer's. In Parkinson's, there is an unexplained degeneration of dopaminergic neurons and an imbalance between dopamine and acetylcholine. In Alzheimer's, there is a degeneration of cholinergic neurons and a deficiency of acetylcholine as well. The cardinal signs representing these disorders include rigidity, bradykinesia, and tremors. These extrapyramidal symptoms affect the motor tract, which controls posture, balance, and locomotion. Let's take a look at some examples. The first drug we would like to discuss is called donepezil, known by the trade name Aricept. This is an anti-Alzheimer's agent and cholinergic. Routes of administration include oral, for adults only. For mild to moderate Alzheimer's, 5 milligrams per day is recommended, and after 4 to 6 weeks, it can be increased to 10 milligrams once a day, except for in elderly females, where it should not exceed 5 milligrams per day. For severe Alzheimer's, the 5 milligram once a day dosing can be increased to 10 milligrams after 4 to 6 weeks, and after 3 months, up to 23 milligrams once daily. Side effects include headache, abnormal dreams, depression, dizziness, drowsiness, fatigue, insomnia, syncope, sedation, atrial fibrillation, hypertension, hypotension, vasodilation, diarrhea, nausea, anorexia, vomiting, weight gain, frequent urination, ecchymosis, hot flashes, weight loss, arthritis, and muscle cramps. Adverse effects were not identified by the Davis Drug Guide. Special considerations include administration in the evening just before bed. Nursing interventions include assessing cognitive functions such as memory, attention, reasoning, language, and the ability to perform simple tasks, and monitoring heart rate. Another example is the drug rivastamine, known as Exelon. This is an anti-Alzheimer's agent and cholinergic, and the route of administration varies. It can be taken orally at 1.5 milligrams daily initially, and increased to 3 milligrams twice daily after 2 weeks. It can also be administered transdermally in a 4.6 milligram per 24-hour transdermal patch, increasing to a 9.5 milligram per 24-hour patch after 4 weeks, and finally to 3.3 milligrams per 24 hours if needed. Side effects include weakness, dizziness, drowsiness, headache, edema, heart failure, hypotension, anorexia, dyspepsia, nausea, vomiting, diarrhea, weight gain, fever, weight loss, and tremor. Adverse effects were not identified by the Davis Drug Guide. Special considerations include taking in the morning and evening with food. Cognitive improvement may take weeks to months to improve, and the degenerative process is not reversed. Nursing interventions include assessing cognitive function such as memory, attention, reasoning, language, and the ability to perform simple tasks. It is also important to monitor for nausea, vomiting, anorexia, weight loss, by doing daily weight checks, and monitoring for allergic contact dermatitis. The next example we would like to discuss is a drug called carbidopa-levodopa. It is an anti-Parkinson agent and dopamine agonist. It goes by the trade name Sinemet. The routes of administration include oral, which is a 25 milligram carbidopa-levodopa 100 milligram, taken 3 times a day that can be increased every 1 to 2 days until the desired effect are achieved, or enterally, but patients must be converted to and be on a stable dose of the oral immediate release tablets before initiation of an enteral suspension therapy. Side effects include depression, involuntary movements, anxiety, confusion, dizziness, drowsiness, hallucinations, memory loss, psychiatric problems, sudden sleep onset, urges, orthostatic hypotension, blurred vision, mydriasis, constipation, nausea, vomiting, anorexia, visor, dry mouth, hepatotoxicity, ileus, peritonitis, neuropathy, and darkening of the urine or sweat. Adverse effects include hemorrhage, pancreatitis, GI perforation, and melanoma. Special considerations include administering on a regular schedule. because sometimes a wearing off effect may occur at the end of a dosing interval. The therapeutic effect may take 2 to 3 weeks and up to 6 months. Patients taking this drug for several years may build up a tolerance. Nursing interventions include assessing blood pressure, monitoring hepatic and renal functions, CBCs, and assessing for signs of toxicity, including tardive dyskinesia and assessing Parkinsonian syndrome. Let's switch gears and take a look at neuromuscular agents. Neuromuscular agents can be classified as cholinesterase inhibitors, anticholinesterase inhibitors, glucocorticoids, and muscle relaxants such as depolarizing or non-depolarizing, skeletal, or centrally acting. Neuromuscular agents can be used for myasthenia gravis, multiple sclerosis, and muscle spasms, specifically in conditions not only to those previously listed, but also for surgical procedures and procedures such as intubation. For conditions such as myasthenia gravis, which is a chronic autoimmune neuromuscular disease that results from a lack of acetylcholine receptor sites, it can also be used for multiple sclerosis, which attacks the myelin sheath of nerve fibers in the brain and spinal cord, causing lesions known as plaques. Muscle spasms are another thing that are treated with this drug and have various causes, including injury to motor neuron disorders that can lead to conditions such as cerebral palsy, multiple sclerosis, spinal cord injury, stroke, and hemiplegia. Muscle weakness is a cardinal sign of these conditions. Let's take a look at some examples. The first example is a drug called metaxalone, or known by the trade name scalaxin. Routes of administration is oral. 800 milligrams 3 to 4 times a day for adults. Side effects include drowsiness, dizziness, confusion, headache, irritability, nervousness, nausea, anorexia, dry mouth, GI upset, vomiting, and urinary retention. Adverse effects are not identified by the Davis Drug Guide. Special considerations include increased CNS depression with other CNS depressants. It should be used cautiously with those who are hepatically impaired, have a history of seizure, are potentially pregnant or lactating, and children under 12 years old. It is also poorly tolerated by the geriatric population due to anticholinergic effects. Nursing interventions. It is important to assess for pain, muscle stiffness, and range of motion. For geriatric patients, assess for anticholinergic effects such as weakness and sedation. Monitor hepatic function tests closely in patients with pre-existing liver damage. Another example of a neuromuscular agent is dantrolene, known by the trade names Dantrium and Ryanodex. The routes of administration vary based off of adult or child. For adults, for spasticity, 25 milligrams can be taken, and it can be increased up to 100 milligrams 4 times daily as needed. Doses also vary depending on whether it's being used for spasticity, prevention of malignant hyperthermia, and post-hyperthermic crisis follow-up. For children over the age of 5, spasticity can be treated at 0.5 milligrams per kilogram daily and should be increased but not exceeding 400 milligrams per day. Side effects include drowsiness, muscle weakness, confusion, dizziness, headache, insomnia, malaise, nervousness, excessive lacrimation, visual disturbances, dyspnea, pleural effusion, respiratory depression, changes in blood pressure, heart failure, tachycardia, diarrhea, anorexia, cramps, dysphagia, GI bleeding, nausea, vomiting, dysuria, frequency, erectile dysfunction, incontinence, nocturia, flushing, pruritus, sweating, urticaria, anemia, aplastic anemia, eosinophilia, leukopenia, thrombocytopenia, irritation at the IV site, phlebitis, myalgia, chills, drooling, and fever. Adverse effects include hepatotoxicity and anaphylaxis. Special considerations. Women and patients over the age of 35 are at an increased risk for hepatotoxicity. Nursing interventions include assessing bowel function, neuromuscular status, muscle spasticity, ECG, vital signs, electrolytes, urine output, and monitoring for when it is being used intravenously, such as in the case of malignant hyperthermia or the prevention of malignant hyperthermia. It is also important to monitor for swallowing difficulties and choking, as well as monitoring liver function and CBCs. The third example for this neuromuscular agent category that we would like to give is the drug baclofen that goes by the trade names gabapentin and leorosal. Routes of administration include oral and infusion. Orally, for adults, it can be given as 5 milligrams 3 times a day, up to 80 milligrams per day. Children over 8 get 30 to 40 milligrams daily, up to 120 milligrams per day. Children 2 to 7 years old can have 20 to 30 milligrams daily, up to 60 milligrams a day. And children less than 2 years of age can have 10 to 20 milligrams daily, up to a max of 40 milligrams per day. Via infusion, adults should have 100 to 800 micrograms daily, and children over the age of 4, 25 to 1200 micrograms per day via infusion. Side effects include dizziness, drowsiness, fatigue, weakness, confusion, depression, headache, insomnia, nasal congestion, tinnitus, edema, hypotension, nausea, constipation, frequency, pruritus, rash, hyperglycemia, weight gain, ataxia, hypersensitivity reactions, and sweating. Adverse effects include seizures. Special considerations include using cautiously in patients with epilepsy as it may decrease seizure threshold. It is also recommended to administer with milk or food to minimize gastric upset. Nursing interventions include lab tests such as serum glucose, alkaline phosphatase, AST, ALT levels, and assessing muscle spasticity. Let's recap. This presentation has summarized a classification for neurological and neuromuscular pharmacologic agents, discussed 3 types of drugs for each category, the typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. This presentation was brought to you by Team All the Azepams.